There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what does it mean to have high blood pressure? This is the most common problem we see these days. About 30% of adults today are hypertensive. High blood pressure is quite easy to control. Before suggesting a medicine or remedy, it is more important to understand what exactly is high blood pressure and the main causes. The moment we understand that, all we need to do is reverse the situation. I will not get into the technical terms of anatomy so that it's easy for everyone to understand. Let's take a look at the blood pressure readings. Although most of you are aware, pre-hypertension can be controlled just by changing lifestyle, but medication is mandatory from stage 1 apart from diet change. Blood pressure is defined as the pressure on the artery walls by the blood flow. 1 reading systolic when the heart pumps the blood, 2nd reading diastolic when the heart relaxes. Arteries expand and contract to push the blood forward, and it requires some elasticity to do that. There are 2 main reasons for high blood pressure. 1. Narrowing of arteries due to plaque formation and obstructing the blood flow. 2. Hardening of arteries preventing them from contracting and expanding. Narrowing of arteries can happen due to plaque deposit caused by increased LDL cholesterol or a few other salt deposits. Hardening of arteries is mainly caused by increase in sodium intake. The amount of sodium required per day is a debatable topic. Sodium is naturally available in all the food products and is sufficient for normal activities. However, if you work really hard sweating out or you are an athlete, then the sodium intake has to be around 2,000 milligrams per day. Since each of us require different amounts of sodium, I would advise to get a serum sodium test done for a couple of times until you gain confidence than living in the dark. Now let's look at how easily we can bring down the blood pressure to normal levels. 1. Reduce salt consumption. Avoid processed foods as all of them have a lot of salt in them. Since we can't completely avoid processed foods, make sure to have at least 30% of your diet to be raw, like fruits, salads, sprouts, etc. Make sure not to have more than 2 grams of salt, which will have 800 milligrams of sodium. Rest will come from the food naturally anyway. Reducing salt in our favorite dishes might be difficult, so the more fruits, sprouts and salads you have, the better, as they don't need any salt for taste. By the way, you only need to practice low-salt diet for 10 days, as the cells and taste glands refresh every 10 days though. New cells will be used to low-salt diet and you will find it tasty as before, even with less salt. 2. Increase water consumption. One should at least have about 3 liters of water a day, while 4 liters is ideal. Start off the day with 1 liter of water early in the morning and have it regularly after 2 hours of every meal until 6 p.m. in the evening. Yeah, you have to visit the washroom way too often, but that's the idea. Water takes out the excess salts in the body. 3. Reduce LDL cholesterol. Now this is becoming too scientific, but to make it easier to understand, have more plant food. 4. Vegetable juice. While it has a lot of micronutrients, the soluble fibers in the vegetable juice help clean the walls of the blood vessels. Make sure to include one of these: rip gourd, bottle gourd, snake gourd, and add tomatoes, carrots, cucumbers, beetroots as per your choice, along with lime juice and honey. Have it at least an hour before your breakfast. Follow this for a couple of weeks, continuing your medication. Seek your doctor's advice if you can reduce the dosage. All the best.